So today we'll be discussing what are the diagnostic investigations to rule out that infertility. What are those tests to be done to discover where that infertility is coming from? However, if you missed our first video on the causes of female infertility and the second one on the causes of male infertility, I advise you locate them. It will go a long way in helping you to understand today's discussion. So what are the diagnostic tests to rule out this infertility via TTC? There's so many of them for the female, ranging from the hormone profiling done in the early and the late phase of your cycle to be able to capture if you're ovulating or not, and also to check your ovarian reserve to be sure you have enough egg to be able to make that ovulation happen. We have the imaging test ranging from HSG, which is a special kind of X-ray that checks to be sure that those tubes are patent, meaning that those tubes are not blocked, that the semen can actually swim to where the eggs are. We have the pelvic scan to check the uterus. We have the transvaginal scan, also to check the uterus and all the surrounding structures. You have what we call the laparoscopy, which involves an invasive surgery, which a camera and a tube is inserted through the abdomen to check that uterus, to rule out endometriosis, those tiny fibroids, or some other things that can hinder implantation. We have what we call the SIS, so no infusion histogram, in which helps to check a proper look at the uterus to be sure nothing is preventing those implantation to happen, those tiny polyps and so many other things. In male, what we need is a semen. We have what we call the semen analysis, which involves checking the quality, the quantity, the motility count of that patient. We also have what we call the scrotal scan. The scrotal scan will check the surrounding structures to rule out cases like varicocele and be sure there's nothing hindering those sperms from being formed. We have the transrectal scan to check those prostrates to be sure those prostrates are not enlarged, disrupting the production of that semen. And also so many others, like checking your sexual history, some physical examination by your gynecologist. All this will help in finding out where the problem of that infertility is coming from. However, after all this, diagnoses are taken and investigations are taken, there's still way forward. Join me in my next video when we're discussing what is the way forward after all this investigation. I really sincerely thank you.